In this video, we show you the correct clinical procedure of biofilm disruption and air polishing with the Actian Air and Go unit. Before starting the procedure, it is essential that a full medical history is obtained from the patient. Air polishing with sodium bicarbonate powder, the classic powder, is not advised on patients with respiratory conditions such as acute asthma or COPD, on deciduous teeth, in pregnant or lactating women, or in patients with renal dysfunction or on low sodium diets. The handpiece is nicely balanced and sits well over the top of your hand, reducing wrist and arm strain. The sleeve and nozzle can be digitally rotated to ensure perfect angulation of the spray in all areas of the mouth when the unit is in use. There is no set protocol on which powder to use first. However, we are starting with the gentle perioglycine powder and the supra nozzle to remove biofilm gently from the teeth and the gingival margin. The nozzle is angled towards the gingival margin and small C-shapes are made from the margin up towards the incisal edge or cusps. The use of high volume suction is essential. Once all areas of the mouth have been treated, the nozzle can be swapped for the Perio Easy nozzle, and residual periodontal pockets of 5mm plus can be treated by inserting the tips subgingivally and spraying the powder for 5 seconds in each site. The nozzle is gently moved in and out of the pocket to ensure all surfaces are thoroughly cleaned. It is essential that this is only done in a pocket that's been treated and now requires supportive therapy. There should be no bleeding on probing or suppuration from the residual pocket. To remove extrinsic staining and newly formed mineralised deposits, the classic sodium bicarbonate powder is used. Discard any remaining Perio powder and fill the chamber with the classic powder. Do not fill the chamber over the max line indicated. The nozzle to use with this powder is the supra nozzle. When using in the mouth, the tip must point away from the gingival margin, pointing towards the incisal edges and cusps. As this powder has a large particle size, great care must be taken to protect the soft tissues. At the end of treatment, the patient should be advised to avoid eating or drinking anything other than water for 1 hour. This is the approximate amount of time for the acquired enamel pellicle to fully develop. Pastes containing fluoride, calcium and phosphate, such as tooth mousse or Biofilm toothpastes, can be applied to aid protection of the enamel during this time.